My name is Marie-Claire Wangari. I'm a medical doctor by profession, but I'm also one of the founders of RESPEKT, which essentially stands for the Reproductive and Sexual Health Program for Kenyan teenagers. So RESPEKT is a Kenyan and Danish social change program that essentially is trying to bridge the gap for sexual reproductive health services, as well as try and offer peer-to-peer education amongst teenagers in underserved high schools and also amongst the youth demographic in universities. We were founded in November 2015, and to date we have close to 150 youth volunteers who are mainly health sciences students and junior healthcare workers, as well as we reached about 8,000 teenagers from underserved high schools based in the counties where there is a medical school. That's essentially Meru, Nakuru, Kisumu, Nairobi, among other counties, and also Murang'a County. And also we work with partners such as the Gender Violence Recovery Center to have key discussions on how gender-based violence affects the youth demographic, especially in a university setting. And we've had also youth panels and youth festivals to try and bridge the gap towards gender-based violence. To date, our biggest success story for RESPEKT is the number of teenagers that we've reached and the number of lives that we've impacted through our training sessions with these teenagers. You find talking about sexual reproductive health is normally seen as a taboo, but when you go down to these high schools and they see someone who's a future doctor or a future pharmacist or a future dentist talking to them about reproductive health, they open up and they share their experiences, and you're able to sort of address key areas in sexual reproductive health. Key of our challenges came up during the COVID-19 pandemic. As I mentioned earlier, most of our volunteers are health sciences students, and also we target high schools. So with the pandemic, there were school closures, and hence facilitating our workshops hit a snag, and we had to find a way of getting our message across and continuing with not only our capacity building efforts, but our advocacy messages. And one key thing that we did during this time was start recording, we call it most significant stories from teenagers on how the RESPEKT program has impacted their lives, stories from volunteers on how being a RESPEKT volunteer has changed their life. And we realized through this aspect of sharing your story, we are able to not only impact future generations, but also create a memoriam of stories to share with future generations of people who will probably engage in RESPEKT. Currently, we are in about 8 counties. And our aim for RESPEKT is to try and reach all the 47 counties of the country to try and make it more a national program. That's our first aim. And also our second aim is we realize there's a gap in the sexual reproductive health education that we offer in high schools. Different organizations offer their life skills in different ways. So one of the key things we are working on is to try and come up with a standardized curriculum on how to offer reproductive health talks and reproductive health life skills. And we hope that in time to come, we'll be able to have the necessary national approval to make this possible. Being part of the Zuri alumni program is a humbling experience for one, and also it offers a source of empowerment for not only me, but also future and current volunteers in our program to see people who are doing, especially ladies who are doing amazing things in their various fields of work, and to see possible ways of where you could reach as a Zuri alumnus. So it's my hope that not only for myself, but also for RESPEKT as an organization, we'll be able to get benefit from the mentorship and the empowerment of being part of the alumni program. In regards to celebrating International Women's Day, one of the key things that we are aiming to do is have university conversations essentially on what breaking the bias means, what gender equity is, why it's important, especially in the current year that we're in this year of 2022, which is an election year, why gender equity is such an important topic, not only in the reproductive health space, but also in the leadership space. So it's our hope that we'll be able to have these conversations and come up with key outcomes to advocate for during that day.